Now it's Teresa the dentist from Bracknell. Hi, Teresa.
Hi, Andrew.
We usually speak about, being a dentist, and, sometimes there's a story in the news about being a dentist. We ask you to talk about it. You've just been to Morocco, though. Tell me why.
We go every year. This is now our 4th year, and we go to treat some disadvantaged children in the northeastern part of Morocco.
How did that start up?
A friend of ours used to do motorcycle trips to Morocco, and he through that sort of area around the Rift Mountains, and you found there was quite a lot of deprivation. And because obviously he was friends with ourselves and a number of other dentists, he said, well, how about we do something? And he was then also great friends with the Belgian attaché at the Moroccan embassy.
As you do.
As you do, and that's really how it all got started.
So when you clearly got limited scope to be able to look after people, what kind of dental care are you able to provide?
It is quite basic. There's a lot of extractions. We do try and make sure that all the kids get a toothbrush and toothpaste and some dental health education. And those kids that actually don't need to have treatment at the moment, we do a fluoride treatment on them, which helps prevent decay.
Mm-hmm. What is the root of the tooth decay that you're seeing there?
They have a very high sugar diet. On top of the fact that they drink mint tea with lots of sugar in, and they eat a lot of honey, they have all their savoury dishes seem to have a lot of sugar in, and they have a lot of sweets and fizzy drinks as well, with very little dental care or toothbrushes, toothpaste and fluoride in the water.
So it's partly an education thing, of course.
That's right.
How much difference can you make, though, when you go out there, reasonably rarely? I mean, most of us are brushing our teeth twice a day.
Yeah.
I guess, isn't it, the impact you can have is small.
Well, hopefully it will build. The first year we went, I think we saw something like 50 children, and we were totally appalled at the level of decay, and we had very little equipment, so we couldn't really do a great deal. And then when we went this year, we've now got 6 portable chairs, we've got a lot more equipment, and a lot of support from our suppliers, such as Henry Schein, and because we're a lot more organised now, we are starting to be able to do more on the educational side of things. So we're hoping that over the next few years there will be much more.
Is it hard to come home? Because you're leaving behind so much work undone, inevitably.
Yes, it is. It is very difficult. It's quite. It can be quite distressing. My first visit to the dentist when I was 3½, I had 7 teeth out, so I can easily put myself.
What
in
had you been doing before you went?
My grandmother used to make me sugar dummies, apparently,
right?
To pacify me, and so yeah, my teeth were not very clever.
So you'd had a nasty experience yourself.
Yeah.
And what reaction do you get from the young people who are, not used to going to the dentist? What kind of...
Well, they are pleased to see us. A lot of them are in pain, so they're pleased to, get a tooth extracted that's giving them problems. And we get a lot of hugs and kisses from the children and from the parents. One particular case in point, I saw a little 5-year-old boy. He was brought to us last year with a broken tooth, but he was very scared and wouldn't let anybody near him. And this year I saw him, and I've just donated a dental wand to the charity, which is a way of giving the dental injection that's much more comfortable. So I told him we were going to use the magic wand. Or rather through the translator, of course, and his eyes opened wide, magic, so managed to give him the injection without him feeling anything. And we took the tooth out, and I told him it was all done, and he looked at me in surprise as if to say it was that easy. And he gave me a big hug, and then his mum gave me a big hug, and I went and had a little cry after that.
Do you get more hugs in Morocco than you do in Bracknell?
Actually, I get a lot of hugs from my patients.
That's good to hear.
Yeah, we're a very touchy-feely practice.
Even though you're clearly really busy out when you're there, does it still feel like a holiday?
Yes, because we're not working all the time. We did 4 days of dentistry and a 7-day trip. And also because I'm meeting with other like-minded, benevolent professionals, we have a really good buzz together as well. So it isn't just the dentistry, it's also meeting with those same individuals, and you get a lot of feedback and, as I say, buzz from them as well. So it is actually, you come back feeling amazing.
Really interesting story, Teresa. Thank you so much for coming in.
My pleasure.
And you'll go again next year, I've no doubt.
Definitely, yes.
Yeah,
and we've got lots of other charity things we're doing as well.
Thank you, Teresa.